Along with every other NHS organisation, we need to provide assurance not just internally but also to external bodies that we're delivering care in a safe way for patients and our staff. Before the launch of the training interface, our training was delivered in a number of different ways, and we used to get a lot of feedback from our staff that they found it really difficult to know and understand the training that they had to do and also find ways of accessing that training.
It was difficult in knowing when you were due for an update with training. So one minute you'd be in date, the next minute you'd be out of date. You struggled on finding out where you could complete this training, and it kind of put you off because it meant you were chasing around a lot of problems trying to find out how to complete your training.
2 years ago we were about 45% compliant overall within the Trust for our mandatory training. With the launch of the training interface, we're able to use a much more diverse number of ways of delivering that training. We've seen a massive increase over the last 2 years, and we're now at 75% compliance over all our mandatory training topics. The most important thing for us was about providing clarity for our staff on the training that they need to do. So we're absolutely able to do that now. Every individual member of staff can see exactly what topics they're required to do, and that's got really great feedback from all our staff.
It's really simple to use. It tells you when you're due to be out of date 3 months in advance, so you've got a good 12 weeks to organise completing that training. It also tells you where to go for your training, how you can book on to different training courses. Basically tells you step by step what you need and when you need. It also tells you what's mandatory and what's priority, so you know which to target first. You can access it on your mobile, on laptops or iPads, so you can do this at home, or you can do it on your lunch, anytime, anywhere basically. Yeah, it's made it easier, so it makes it a more positive experience. It makes you want to complete your training. We are very busy, so the easier they make it for us and the more accessible it is, well, the better it is for everybody, and obviously the more training we have and we're up to date with, the better that is for our patients.
What we're really hearing from staff now is that previously they didn't do their mandatory training because they didn't know what they had to do and they didn't know how they did it. Now that those two barriers have been overcome, they actually are quite willingly and happily engaging with their mandatory training because they recognise how important it is in terms of delivering that safe patient care.